Good morning, students. Today we have the introduction to child screening and assessment. So before we go into the topic, we'll discuss about what is the difference between developmental deviance, developmental dissociation and developmental regression. This is as an introduction. It is better to know about these particular terms. So the developmental deviance is a delay in development. Physicians should also recognize deviations in development. Deviance occurs when a child develops milestones or skills outside of the typical acquisition sequence. An example of this can be seen in conditions such as cerebral palsy, in which the infant rolls over early secondary to increased extensor tone. Developmental dissociation arises when a child has widely differing rates of development in different developmental domains. For example, children with autism often have typical gross motor development but significantly delays language development. Therefore, language development has dissociated from gross motor development. Developmental regression is when a child loses previously acquired skills or milestones, and although less common than the other patterns, should cause the greatest concern since it is often associated with a serious neurological and inherited metabolic disorder. So children will have different kind of developmental problem in different ages. For example, social emotional disorders starts once they start going to school. Attention deficit or hyperactivity disorder, it is prevalent in most of the cases, around 7.8%, but it can be observed when the child starts schooling. So early identification is important for child screening and assessment, and parental case history, parental interview. The case history taking with the parents is very important when you are doing the assessment and child screening. So there are so many precautions we need to take care when you are doing the assessment part. Before we start learning about assessment, we need to keep all these things in our mind. So what are the risk factors of developmental delay? History of abuse or neglect. There may be a kind of a neglect happened in the child's life which we are not aware, which the parents are not aware. So that can also lead to a developmental delay. Usually the siblings, the child is getting the most attention when he was at home. When the siblings comes, so the child can reduce the attention by the parents. And parents with less than high school education, sometimes the parents are not educated, that also can cause this kind of neglect. Parental mental health problems, sometimes the parents are having anxiety or depression, so that can cause the child to not to get enough attention what is required. Housing and food instability, sometimes poverty, and also the house facilities are not enough for the child for his own growth. Ethnic or linguistic minority, that is also another risk factor for the developmental delay. And children less than or equal to 3 years. So this stage is very important for children. And authoritarian parenting style. Example, highly directive or rarely engaging verbally in child's unique interest, or punitive parenting. So this can also risk factors in developmental delay. Only about 25% of children with developmental delays are detected prior to school entrance, meaning that most children with problems will have missed opportunities for early intervention. So before we assessing, before we learning all the tests, we should be clear that early identification is very important. Although clinicians are effective at detecting severe disabilities associated with congenital, metabolic or genetic abnormalities, providers are far less adept at discerning the more common conditions because these typically lack overt dysmorphology. What is the reasons for under detection in primary care centers? Dependence on non-standard administration of standardized screening and also the lack of resource people. Failure to continually check on developmental progress. So once you have done a testing, you cannot leave the child there. You need to have a follow-up. Clinical judgment, because it tends to depend heavily on dysmorphology and organicity, which are not present in the majority of children with disabilities. Another reason is requirement of repeated screening test failure before making a referral. So, which are the tests we can appropriately use for, which is age appropriate test, which is useful for the child, that has to be decided. And due to lack of awareness that quality screening measures are highly reliable and that a repeated screen is likely to yield identical results. So these are the risk factors for underlying the missing primary care. So once the child has detected in the early phase, it will be easy to start the intervention. Another reason is false optimism about outcome. Children rarely outgrow developmental problems in the absence of intervention. Discomfort at delivering difficulty news. So how do you inform the parents about the children's difficulty? How the parents understand what is the difficulty? That is another reason for the developmental delay. And lack of familiarity with the tools effective for busy primary care setting. So primary care setting has all these risk factors in identifying the children's problems. So next class we will start with the testing one by one. Before that we will have an introduction to each test and then we will learn one by one. Thank you for listening.